A scramble to stockpile spreads to China's capital from its frustrated financial hub. 3.5 million people in Beijing's largest district ordered to get tested for COVID-19. Let's pick up on that COVID-19 situation in China. Professor Jaya Dantas from the Curtin School of Population Health joins us live from Perth. Professor, what we're seeing, the official message from Beijing right now is that mass testing will determine if further measures are needed, and that includes lockdowns. We've already seen lockdowns in more than 12 districts within residential buildings in Chaoyang district. And as we know, Omicron, plenty of asymptomatic cases. So if you've got this mass testing, you are going to find many, many, many more cases. So can we take it for granted that we are going to be seeing lockdowns in Beijing?
I think we will see lockdowns in Beijing, and that has been the feature of the Chinese government in other cities. We've seen that now for the last nearly 30 days in Shanghai.
Well, I suppose the big question here, and many analysts have said this, experts have said this, that zero COVID is not practicable. However, China's position is that given the relatively low vaccination rate amongst the elderly, it's about 81% as of last week, and as also half admitted that Sinovac, perhaps that vaccines used in China may be less than effective against Omicron, it's a very real danger they're looking at, loss of life and complete immobility in the medical health system. So it is real, this danger of loss of life, should they lift measures and just let things take their course. Would you not also admit that much?
At this stage, I don't think they could lift measures. They need to continue with their dynamic zero COVID policy for the next short term, at least, because apart from mass testing that they are doing, they would have to have the people getting their second and third dose rates really higher up, and especially among the vulnerable, not only those who are elderly, but also those who have other vulnerable conditions.
So in other words, what we've seen in Shanghai, despite the public anger, this is really for the good of the people.
In Shanghai, what we've seen is 30 days of lockdown. We've seen that actually the harsh lockdown that is there can be reconsidered by the government. So the government is continuing with its mass testing policy. One of the things about the mass testing policy is in the earlier days of the pandemic, it was used as a mitigation strategy where they had the testing and then they would do the contact tracing. But effectively with the Omicron variant, and the high transmissibility of the Omicron variant, as well as the asymptomatic nature of the Omicron variant, it is really difficult to manage the transmissibility of this variant. And then having this mass testing becomes really labor intensive and very, very expensive. So it will depend on the government as to how long they want to continue with this strategy. One thing is, there are social, mental health, psychological impacts of these harsh lockdowns. And also there are economic impacts because many of the cities in China are economic hubs that actually navigate supply chains, not only in China, but throughout the world.
China's COVID-19 expert, that's Dr. Zhong Nanshan, has proposed as of April 6th what he called strategies for reopening in the forthcoming COVID-19 era in China. I won't go through the entire paper, but some of his recommendations will be vaccination with what he calls homologous vaccines. So, for example, after 2 doses of Sinovac, to take an mRNA vaccine as well, to have more targeted testing, to focus more attention on targeted medication for people who have COVID-19. Is this a way for China to slowly move away from mass testing, but not moving away entirely from COVID-0?
Yes, I think so. I think it's a really good strategy to see that those who have had 2 vaccines, to see that they get the 3rd vaccine. And the 3rd vaccine should be there across the population. And this is challenging. But if we can have the mRNA vaccines in the country, that would be good. But at the same time, we know that we have the antivirals that are available in other countries and given to those very early on when they get COVID. for those who can, to prevent progress of the severity of the disease. This is to those who are the most vulnerable, like the elderly, who have other comorbidities, chronic conditions, and those who are immunocompromised. So that can be started, because this is something that is happening in other parts of the world very effectively. So this is something that they can continue with and commence in many parts of the country, especially where there's high rates of transmission of the Omicron variant.
Oh, thanks very much for all that insight, Professor Jaya Dantas from the Curtin School of Population Health in Perth.